Case counts and hospitalizations continue to spike in Idaho. Earlier this week, the Idaho health director said the healthcare system in the state is under pressure because of the current surge. Here are the recent numbers. Yesterday, health officials reported 4,088 new cases and 12 new deaths throughout the state. This brings the state's total number of confirmed cases to 289,478. And due to the recent surge in cases, approximately 40,900 outstanding positive lab results are pending review and follow-up. A new subvariant of Omicron is taking the world by storm. It has already been reported in at least 55 countries, including the U.S. Rena Roy explains why some are calling it the stealth Omicron.
More than 2 years into the coronavirus pandemic, some hospitals still feeling the strain.
We see our hospitals here in Minnesota have been overwhelmed for months and months and months, and it's just not sustainable.
In January alone, more than 17.4 million new cases have been reported in the U.S., nearly 3 times every other month since the pandemic began. But in a sign of hope, the daily case average has dropped by 18% over the last 2 weeks.
I'm actually optimistic about what's going to happen after we get through a rough next probably 3 to 5 weeks with Omicron.
As the country crawls its way out of this surge, officials are now tracking a new subvariant of Omicron called BA2 spreading around the world, including here in the U.S. The World Health Organization says it is not a variant of concern and does not appear to be deadlier than Omicron, but it is known as the stealth variant because it can be trickier for scientists to pinpoint its exact version. But PCR and rapid tests will still work to detect infection. Experts say the more the virus spreads, the more likely new variants and subvariants will emerge.
What we need to do is to lower the amount of replication of the virus anywhere. And that means, get everybody vaccinated, not just in the US, but the whole world. And so if we can lower the amount of virus, fewer variants, fewer things to worry about.
And when it comes to vaccinations, health officials are urging more Americans to get their boosters. A new study out from the National Institutes of Health finds mixing and matching boosters is safe and that it creates a similar immune response to those who stick with the same vaccine series. Rena Roy, ABC News, New York.